So what does an audiologist actually do? An audiologist works with patients that experience the symptoms of hearing loss, tinnitus, vertigo, dizziness, and imbalance. We work closely with other healthcare providers. We specifically work closely with otolaryngologists or ear, nose, and throat physicians. Audiologists carry graduate degrees. Currently, they are required to have a clinical doctorate. They do an externship, and they have thousands of hours in clinical care before the time they graduate and become a licensed provider in their state that they choose to work. Audiologists conduct diagnostic evaluations. They also focus on remediation of symptoms. When you meet with us at our office, we will begin your appointment with an interview. We then look in your ears with an otoscope. Following that otoscopic examination, we conduct a test called tympanometry. It's a pressure test. It is not a hearing test, but it tells us how well your tympanic membrane or eardrum and your middle ear bones are moving. So that's called a middle ear test. Then we take the patient into a sound-treated room, into a booth, and we put insert earphones in the ears and a tight band called a bone oscillator behind one of the ears on the mastoid. And we do a series of tests using pure tones and speech to evaluate your hearing sensitivity. A point that I think that's really interesting for patients is that when someone looks in your ear, they cannot actually tell how well you hear. When a doctor looks in your ears, they can tell you if you have a wax impaction or a foreign object or any debris, or if you have any swelling or redness. They can look at your tympanic membrane and tell you if it looks pearly gray, which is normal, and if there's a good light reflecting off the eardrum. They can also tell you if it's red or inflamed, or if they see fluid behind the eardrum. But when one looks in the ear, they cannot actually tell you how well you hear. What an audiologist does is they test your hearing, and we can actually explain to the patient the degree of hearing loss and the type of hearing loss and how well you understand words. The third type of a provider in hearing health care is a hearing aid dispenser, and this is someone that has been trained to test hearing for the purposes of fitting hearing aids. So audiologists have a very wide scope of practice. We focus on evaluating hearing for possibly medical management, and then if medical management is not an option, then we talk with the patient about appropriate devices and technologies to help them. But here's a key point, and this is very important. Devices are integral to management of hearing loss and tinnitus, but it's the expertise of the audiologist that is really going to help a patient. Using communication strategies, using appropriate programming techniques to optimize a fitting, those are the things that are going to be really important to outcome. And we look forward to providing that kind of care to our patients.